Ma'am, your mic is on. Yeah.
Sorry. Yeah.
Yeah.
Okay.
Before inviting Dr. Manju Dandavani to speak with you, I invite Dr. Lata Venkatesan, Principal, College of Nursing, to speak few words and introduce her to our alumni. Yeah.
Yeah. Good morning, everyone, and welcome to Dr. Manju Dandapani, today's star speaker. She is here to share her experience, how she has become an independent nurse practitioner in the field of neurology nursing. And actually, when I posted the flyer in the Facebook and other social media, many were appreciating this is a wonderful topic. You know, many were eagerly asking, "What is this?" And they are all awaiting to hear from you. And Alumni Association of College of Nursing AIIMS is recently developed with a Telegram group, and the alumni of AIIMS College of Nursing are placed in various illustrious positions across the world. And we are so delighted to see the growth and the contributions made by our alumni to the nursing profession. And we invite alumni speakers every week to address our students, especially because for the younger generation, they will be role models and they will get inspired and they will dream one day we will also reach to these kind of positions. And the success of any institution is measured with the growth of the alumni members. That way, AIIMS alumni, AIIMS College of Nursing, New Delhi feels very proud of our alumni. And today's speaker, Dr. Manju Dandapani, is one of the well-known person in India as well as in many other countries. And she is known for her contributions in her area of specialty. So welcome, Dr. Manju, and we are all awaiting to hear from you. Thank you.
Thank you so much, ma'am. Thank you so much. First of all, I would like a very good morning to one and all. First of all, I would like to thank Dr. Lata Venkatesan, Principal, College of Nursing. Thank you so much, ma'am, for initiating this group, first of all. And I have attended 2 sessions of this. This was really fantastic and very happy to know that everyone is doing so well in our profession and contributing towards our profession. And as ma'am told, the growth of the institution or the success of the institution is by the members of its alumni. Definitely, ma'am. Thank you so much once again. And thank you, Dr. Muthu, for guiding me and coordinating the entire program. So I was asking Dr. Muthu, like, though when he asked me about this, the topic which was in my mind also was the same. And the same time, I asked him, what topic shall I deal with? Then he also told the same topic. So there's no doubt that this is what, and I think you are destined to hear today. So no doubt about it. So I'll just share my screen to start with my presentation. Yeah, is it visible?
Yeah.
Yeah. So today I'll be going to talk about nurse-led care in neuroscience nursing, a journey from research to practice. So journey from research to practice, we can call it as a road less traveled. So before telling about the research journey, I would like to share about my professional journey. I joined AIIMS Delhi in 1996 and 2000 I completed, and after that, I was working there as a nursing officer, staff nurse in neurosurgery ICU. So I remember learning so many. I used to be so curious in learning. Though I was a silent student, many of the teachers may not be thinking me as a very smart student, just a silent student. I was learning. It was a great opportunity in learning from each and every teacher in AIIMS, each and every ward and clinical. When you go around the AIIMS, you know that you learn so many disease conditions, you witness so many patients. And with all this experience, I just moved to the clinical experience. And that was so enriching experience that I got in the neurosurgery ICU and other ICUs of AIIMS, like during my study also. During that time, I still remember that, I still feel that if I get that time again back, how much more research and evidence-based nursing practice we can implement in, because when I was working that time, that in ICU after my BSc, I did not have any idea about research or evidence-based nursing practice was not existing that time. So though clinical competency I acquired, I still feel we could have done more research in that area. But however, after that I was doing my MSc. It is not only I could acquire the clinical competency, when in MSc, when each and every subject like administration, education, research, when teachers were teaching, every word used to hit my brain. Okay, this is where you had to, because my clinical experience told me this is where you need to implement this particular piece of research, this particular piece of education or administrative principles like quality of life or like a Grenadian model, whatever it is. Like everything I used to know where they need to be implemented. So that was really a good correlation or coordination which took place in my brain during my MSc period, and MSc really expanded my vision. And I really, like, I would say that when I was in BSc, if someone is asking me what I doing, maybe my friends or in my neighborhood in my hometown, I would say I'm doing BSc honors, and nursing I used to swallow. To be frank, I am telling, BSc honors, nursing, I used to saw that I don't want anyone to hear it, because I was, to be frank, I was not that happy that I'm in nursing, though I used to learn a lot. But then after MSc, I really felt that I can always say that I'm a nurse. I never regretted. I always felt, and I always understand the significance of being a nurse. So after my MSc, I worked in AIIMS College of Nursing as a faculty for some time, where I learned a lot of values of teaching, how to teach. And after that, I worked as a nurse educator in one of the private hospital, where I learned to understood the struggles of the nurses who are working in a private hospital. Then I worked in a private college of nursing, where I really understood how the education is being used as a business, and how people are manipulating the nursing education, and what kind of nurses are coming out, produced in our country. So I was, it was really giving burden to me, a lot of burden to me. That is really has helped me in developing my vision. Then after that, I worked in JIPMER, and now I am in PGA, and I believe that God has put me over here because I'm needed over here. So today we are going to talk about journey from research to practice. So a road less traveled, and let us just look into a moment on the road less traveled. So when we talk about nurses, we know that the major healthcare contribution has to come from nurses, because in number, if you see, nurses are more, the majority in healthcare profession. So, but if we really look, so that is not happening in our country. So I used to feel that, see, in AIIMS, majority of you are AIIMS alumni. So in AIIMS, every student who was in my batch was the best outgoing student of their school or college. So, you know that even now also the same trend may be going on, I think. So after my MSc, I really felt that, see, like being such a good students, good people, and the profession in which I am. So people look down that profession. Is that right? No, it is not right. So we really need to change it, and we all have good potential, and nurses and nursing, now the present generation, they have a lot of potential and ideas and visions, and because of the exploration of technology. So this feeling I always had, and then I thought we can contribute much to the nursing profession. But then later I understood that. So like I remember that during that time only Dr. Gopichandran had started this Empower group. And I used to initially feel that, okay, I am alone with this thought. But then we used to share a lot of ideas in that group, and we used to feel that it's not only me, many people have the same kind of vision that we need to really contribute to the nursing profession. So, but sharing vision, many were there, but when it came to doing, we can only find very less people. When everyone has ideas, when it is coming to implementation phase, it is a bit difficult. Everyone has to move out of their chair and do some steps. Then only we can. So I thought it's not easy for everyone to work in cohesion. It is difficult. So at least let us do what we can do in the place where we are. So that's how I thought I need to do something differently. And my thought was so much related to patient care and how nurses can contribute towards healthcare outcome. Because nurses have a lot of competency. Our syllabus is so rich with skills and knowledge. but we are not utilizing our autonomy that we actually have. We are always been labeled as physician made on. We ourselves many times demonstrate that is whatever and there is a norm also, doctor's order. I did this as per doctor's order. I never call it as doctor's order. I always write and say it is doctor's instruction. So similarly, so we ourselves are becoming submissive in our profession, but we should not be that. We have to be assertive, and we should utilize our autonomy to implement various nurse-led care to improve the healthcare outcome. This is my advice to each and everyone who is listening to me. So we know that we all are good in becoming good in research nowadays, because we have a lot of faculty and a lot of input, a lot of software and assistance. So becoming good in research, and many of us are doing specialization, short courses, and nowadays many short courses are coming up. So we are making ourselves green pastures, but what about the practice side? It is still like a barren land. So there is a big gap you can see between the our skills and competency and the actual practice which is happening over here. So what is the solution? So that is nothing but evidence-based nursing practice. Like implementing whatever we know into the clinical practice through various quality improvement initiatives. So when we have the right, when we can do all these things, our patients should not be suffering because of our negligence or our less provision of care to the patients. We are not exercising our autonomy, our care, and that should not affect our patients. A right delayed is right denied. So we should not let our patients to get a care which is neither delayed nor denied. So we have to ensure that whatever they deserve from a nurse, when in abroad nurse, the patients can receive so much care from the nurses. Why not in India? Why they have to always remember only the doctors who cared them? We have to also be remembered. We also have to be acknowledged. That is possible when we exercise all our care, all our skills and competencies. So let's just looking backward to go forward. We always say that. So this is my beginning of my nursing research. In my 4th year BSc Nursing, as a team, we did this study. I remember few of the classes, Dr. Manju Valsa, who has taught us in 4th year on research. So, and we did the study, utilization of AIIMS services in urban slum, which is a slum which was in front of our Masjid Maud hostel. So we went to house and we know that like small huts, and we assessed this, and we came to know they are not utilizing, and we encouraged them to utilize the NC services in the hospital. But that time, after that, what to do with this? We did not know about how to implement, what implementation can be done, though it must have been written. That because that research into practice was not that much. So this definitely went to the shelf, no doubt about it. And then I came to my Msc Nursing. So in Msc Nursing, I can say that it was like this topic was selected in my thesis topic presentation, that is the study to assess the nutritional status in patients of severe head injury. And I was privileged to get my guide, Dr. Meena Madam, and then a lot of input from Dr. Manju Valsa, Sandhya Gupta ma'am in research, and from other statistics teachers, and a lot of input from the co-guides, like I remember A.K. Mahapatra sir. So used to guide and broaden our vision. And when I came with the pilot study finding itself, he told, you need to slightly change your protocol and expand your study, because this is a topic which was only studied in 80 some aspects. Then we did a lot of studies. For example, in admission head injury patients, we came to know that albumin is very less. How can it be possible in a patient just admitted within 24 hours? Then he told, and then we decided with his guidance and took permission from the blood bank, and went to the blood bank and collected the blood from the donors and checked the albumin. Yeah, it was really low. It was nothing to do with the nutritional status of the patient. It was due to head injury. So based on this, we continued the study. He made me to continue the follow-up till 3 months, 6 months, and a lot of outcome assessment. And we could publish various aspects, because a lot of good findings came, and we published in many articles, many outcome variables we compared and we published. And this all got good citation. You can see that. And these all are the articles which are published. And I still remember, like when sir came here, Dr. Mahapatra came here in PGA, he called me. He came to conduct the exam. He called me personally and introduced me to the HOD of neurosurgery over here. He told she has done a lot of work in nutrition, so make use of her. And we have developed a nutritional protocol for the head injury patients over here. And wherever he used to go see in conferences and all, he used to acknowledge this fact that we have done a lot of work in nutrition in head injury patients. And later in PGA, we have expanded that work to subarachnoid hemorrhage also. And this is one of the paper you can see here, which has been published in Journal of Clinical Nursing, where we have associated the nutritional status and the pressure ulcer in TBI patients. And you can also see one of our study is being a part of the guidelines for management of severe traumatic brain injury guidelines. This is one of our studies being quoted. So we can see that our small research, if we really take initiative and publish it in good journals, it is going to global level and being utilized at global. That's how the patients are benefiting, not only in our place, globally patients are benefiting. And also, like, we get a lot of satisfaction from this. So this is recently, we did not leave a nutritional aspect over here. We have conducted again OR supplementation in traumatic brain injury patients over here, and we do practice over here. That is, instead of giving water after the RT feed, we give ORS instead of water, we give, and so that help in managing the hyponatremia of the patients. So that also is published. This is recently we did in pituitary tumors with dietary interventions. This is also published in Journal of Advanced Nursing. So this is an RCT where it showed that a small dietary intervention, nurse-led intervention, can change the outcome of the patients and reduce the complications in operated pituitary patients drastically. So I was talking about my MSc thesis. After completing I was so much involved in the thesis work. After completion of my, I felt something like, some maybe a part of my body is, after submission of thesis, I felt something, maybe a withdrawal symptom, we can say, or I felt that something is amputated from my body. I was so emotionally disturbed. Then I again took with my madam, I again then talked with sir and took an ethical permission and done another study which I felt that it was really needed. Pain perception following different neurosurgical procedures, a quantitative prospective study. So a small descriptive study I tried to do it over here. That also was not much studied. So this is what. So now then came to my PhD. So my PhD was impact of cognitive and behavioral changes on caregivers' psychological burden. So here we have found that patients of traumatic brain injury suffer from a lot of behavioral and cognitive symptoms. So I assessed that, and I assessed what is its effect on psychological well-being among caregivers. So this is what my study, I can show you my study. So because you know why this topic is very important, it is not only that patient care is a burden for the caregiver, they share a lot of love and affection and a lot of symbiotic relationship. The patients at times think that, oh, if I am having this pain, if I tell to my wife, it will be hurting her. Let me not tell this. So both are taking care of each other. It's not that caregiver is always taking care of patient. Patient also feels, oh, my wife is or my husband is struggling so much. Let me also try my best. So there is a symbiotic relationship which affects each other. And we understood that they have a lot of neuropsychological problems faced by the traumatic brain injury patients and cognitive deficits in these patients. And these kind of deficits, especially the behavioral problems, are more in type D personality patients. So these all were the common symptoms faced by the patients. And this is an aspect which we never address. And the patients are coming for follow-up. Okay, lift your hand, show your tongue. We assess the physical symptoms. We never assess the behavioral symptoms. But actually, I still remember one caregiver telling me that the caregiver was telling that, actually, when if my patient is totally bedridden with quadriplegia, I would have been happy to care. But his agitation, anxiety, irritability, these are the things which are really disturbing me. And never cooperates, never have medicine, never comes, never is willing to, for a bath or anything. So this kind, because of that, I'm really burdened. So this kind of things are happening. So we have assessed the caregiver burden also. So like we assess the caregiver burden in TBI patients, and we found that what are the, so this is the, we understood what are the caregiver burden of the patients and caregiver, that particular paper after publication, even I got again best publication award in PGI for our caregiver burden paper. So like that is not only among nurses, among all the faculty of the. So it is, I'm not telling to boast anything. I'm just telling these things so you can do it and you must do it. So after this intracranial tumors, we just progress like traumatic brain injury. Similar things we have done in traumatic brain injury about the cognitive, behavioral, and functional impairments in traumatic brain injury, in stroke, and we found that this behavioral symptoms are not only part of intracranial tumors, it is part of many neurological and neurosurgical conditions. And we also, from the other, when I further explored the literature, then again we came to know that it is post-stroke depression and this kind of symptoms are very common. So it's not whatever I'm going to do is not based on only my thesis or my findings. I cannot do that, you know that. So I had done vast literature search and we used to find out what to do. So when we were doing, so these all were the findings which came, neuropsychological deficits in patients of neuro illness like cognitive deficits, and emotional disturbance and behavioral changes. We will not go to the topic aspect into detail. I can explain you how we have done. This is the paper I told you that it was well appreciated by PGA and the caregiver burden. So why caregivers need to be cared? Why it is important? So caregivers need to balance caregiving with their other activities. They may be working, they may be like school teacher or a teacher like us or any professional. They need to manage family. So emotional health and employment status of the caregivers are affected. That can result in depression or low depression like dysthymia, high stress, low general health, or impaired functioning in caregivers. So that impaired functioning of the caregivers can reduce the care provided to the patient. So it's a vicious cycle. So it's influencing each other. So we need to empower and keep the caregiver in a good health. So at the end of, towards the end of submission of my thesis, I used to discuss this with Dr. Sandhya Gupta ma'am, and a lot of discussion, and ma'am used to tell that you have to do something, you have to do something for this patient, and then that kept motivating me, and ma'am used to give a lot of ideas, and I still remember the chapter which ma'am made me to write on action forward, the way forward after the thesis. So there I put all my thoughts along with, after discussing with ma'am, whatever possible things we can do, we put it, and I felt that it should not be just on black and white. We need to put it into practice. So I thought where to put, how to put it into practice. How can, I'm just a College of Nursing teacher, faculty, and the patients are coming to the ward and they get discharged from there, and I go to neuro ward definitely to supervise. That is the only connection with to the institute. So how can I proceed? How can I? So this new rehabilitation, definitely we have good rehabilitation unit. Physical rehabilitation patients are definitely getting, but psychological rehabilitation we don't get proper. Our patients are not receiving. So we have worked on this aspect of neuropsychological rehabilitation. I have explored more. This is nothing but enhancement of cognitive, emotional, psychosocial, and behavioral deficits caused by an insult to the brain with specific interventions. So here sensitizing healthcare providers and caregivers are very, very important and mandatory for a holistic rehabilitation process and outcome. So if the patients, as I was telling, if the patients are neuropsychologically disturbed, the physical rehabilitation cannot take place. Whether it is institute-based or whether it is home-based, the patients will come for the physical rehabilitation. Okay, exercise, gait exercise, they will not do if they are neuropsychologically disturbed. If they are in depression, they are anxious, irritability. So first we need to address this aspect so that we can reduce that. So as I told, the main way of doing it is research into practice is evidence-based nursing practice. So I was thinking, how should I implement this over here? So I did not have any guidance from here how to do it. So I used to discuss with Sandhya Gupta ma'am. And then this used to be my favorite thing. This Donabedian model is something which is of my favorite from my, like when I learned management in Msc Nursing. So I told you that whatever I learned, suddenly, immediately I used to get the clinical application of it. So this is one of the favorite model of mine, and I used to and I always make sure that it is being taught or evaluated among the students, especially MSc students. So whatever comes, I take it in this model: structure, process, and outcome, because our existence is for improving the outcome of the society or our patients. So here, when I talk, I hope everyone knows, so I'm not going to explain about the model. So when I looked at here, what I had. So I know what outcome measures to be measured, but there was no outcome indicator so far, no process. And what I had was some data. I had some data which says that these problems about the patients and caregivers. We have a neuropsychologist for all the patients who can only address the severe patients, who cannot address all the patients. And we have many neuro nurses working in clinical area. And other than that, we don't have any tool, we don't have any place, we didn't have any place or anything. So this was what I had in my, in the beginning what we had. So first I thought we are clear about our outcome. So let us develop the process. So what process? So process has to be neuropsychological assessment, that is cognitive assessment and behavioral emotional assessment, and providing individualized intervention. So assessing the patients, every patient who's coming to OPD, we need to assess them and provide appropriate care. So there are various cognitive behavioral therapy exercises, nurse-led intervention, integrated therapy, complementary. These all came out when I searched the literature. So this neuropsychological assessment, so yes, we had why, when, and how. Because why we have to do neuropsychological assessment, I already told you, they are present. Because they are present, they are not rare. They can be assessed, they can be managed, they can improve quality of life and can improve outcome and can reduce caregiver burden. Because of these reasons, we need to assess them. And when to assess? During the hospital stay, we can assess. At the time of discharge, we can do it. During follow-up, telephonic follow-up can be done. App-based follow-ups can be done. And how to do it? We can collect this information from the patients or from the caregivers, and it can be collected through self-report. They inform us, I have these problems, and need identification checklist. We can develop a need identification checklist. We have developed it, and you use it for the patients to assess their needs, and appropriate tools can be used. Specific tools can be used. So this is the screening tool we had. So we used to use NPIQ, and various extensive tools are there. But for the time being, we are using this NPIQ, that is neuropsychiatric inventory, and various specific tools are there. If any patient is really required, then we use these tools. Otherwise, we are using this NPIQ. And we also use a need identification checklist that we had developed and tested last year. Need identification checklist to identify their needs, patients' needs in physical, psychological, and financial and other domain, what all needs they have, so that those needs the nurse counselor can address. So we are gradually progressing. So this is the beginning. And so you can see that this is another study which was talking about nurse-led intervention for stroke patients' depression. So from these all studies, we came to know that nurse counselor is a good, this thing post, or the person who can have a liaison of the patient between neurologist, neuropsychologist, and neuropsychiatrist, and she can really play a big role. So we have. I told you that these all are the management modalities, and we can plan these things and implemented these things through a neurosurgery nurse counselor. So whenever required, we can just refer the patient. So then that was the time we had, before that we had conducted a systematic review on brief nurse-led counseling on hazardous alcohol use securities in our institute. So it was showing that nurse-conducted brief interventions are effective strategy for reducing alcohol consumption. So you know that nurses may not be, I'm not talking about the psychiatric nurses, may not be that skillful in a proper counseling, but brief counseling can be, and we may not get time also, like giving a proper counseling, 1 hour, 1.5 hours, we may not have time also. So brief counseling, whether it will work or not. So with this thought, we went ahead by developing. So when my next master students came, we developed this intervention and tested. It is a structured nurse-led counseling, brief 20 minutes counseling. This particular content was the base, based on this, the counseling was individualized for each patient. So this we had tested, and this again got a good publication in Clinical Journal of Oncology Nursing. And so we could find that brief nurse-led counseling reduces number and severity of behavioral symptoms and reduces the caregiver distress. So this was my, this was our, main proof to initiate the nurse-led intervention. So these all are the tables depicting that. So again, we got many mails and follow-ups about our article, how to initiate, what you do in nurse-led clinic, nurse-led counselor, what is the process. So I was feeling so happy that we could reach to this level. And this is the protocol. Then we developed our protocol for nurse-led neurosurgery clinic protocol we have developed before. I told you that for the process part. So we have till here, we have developed our structure. Then through this SOP, we have developed our protocol, and we also trained the neuroscience nurse. I told you that many are working. I identified the willingness of one of them and trained her to assess, use all these tools and provide brief counseling. And if required, refer the patient to neuropsychologist and further for the neuropsychiatrist. So at the end of all the planning, this is what we had. So I told you that initially we were here, maybe we were here, only we had this much. We had data, neuronets count. Then we have now neuronets counselor, neuropsychologist, resources, assessment tools, booklets, and OPD. We got a place. After discussing with the HOD, we got a place in OPD to conduct our clinic and process the job description of the nurses we developed, neurosurgery nurse counselor, assessment, brief counseling, referral, further management and evaluation, and outcome we assess is behavioral symptoms, stress, anxiety, caregivers' well-being, etc. So how did we do it? Was it easy for us to do this particular task? No, it wasn't. It took almost 1.5 year to, I think, 2 years for us to implement this. So we developed whatever plan we discussed over here. And then, parallelly, I was trying to convince the HOD of neurosurgery, who never believed that a nurse is required, independent nurse is required for caring this patient, but he was my co-guide. And when all the findings came and presented, he was really convinced. Then it was a great, difficult task for me to convince the MS and NS and NS of our institute. And again, it was very difficult for me to convince the ANS of Neuro ward, from where I had to withdraw this nurse counselor. So this work also was parallelly going when my plan was going on. So with this, gradually we convinced multiple communication between HOD, MS and HOD, NS, and a lot of phone calls, and so many things were going on. And like that, we got finally permission from stakeholders after many meetings. And then we created a post of neurosurgery nurse counselor and initiated the nurse-led clinic by neurosurgery nurse counselor. So now every OPD days, there is a place in the OPD for the neurosurgery nurse counselor, and she will be giving, the patients will be sent to her. Now also, when I talk about challenges, one consultant still now also he doesn't send his patient to, because he doesn't believe in this particular philosophy. But that's okay. We have to move forward. So she addressed the patient, assessed the patients using the tools which we have developed, need identification checklist, and counsel her or refer the patient. Counsel and provide health teaching, and or whatever interventions are required she does, and then refer the patients if required to neuropsychologists. So we can see here the patient is being assessed, I told you that, and brief nurse-led counseling is also provided at the time of discharge, and referral. During COVID, we have done teleconsultation. So as soon as COVID settled in, OPDs were closed, we collected the details of the patients who are getting discharged, telephone numbers, and we had started with teleconsultation. Tele-nursing counseling was started, and as and when required, patients were guided. And this is the need identification checklist I was telling about. These are the various tools. This is the process which is going on. And the outcome that we assessed was functional outcome, quality of life, care practices, psychosocial outcome of patients and caregivers, caregiver burden, patient satisfaction, and number of referrals. And we have also, this is our just initial paper highlighting the importance of neurosurgery nurse-led clinic. Now, rest of the data in the process of analysis, and we will be trying to, publish them also soon. So what all barriers, as I told you, what all barriers we faced, it was a long process. Convincing the stakeholders was difficult. As I told you, I place everything in this particular model, whether it is facilitators, whether it is model, whether it is something, barriers to plan something, I like this model. So like barriers we faced were space for clinic was a challenge. There was no space initially, then we have got it later. Then neuro nurses, it was no one was as such ready to be taking up this posting. Then neuropsychologist is a challenge. Now also we cannot refer all the patients, and resources, assessment tools, need identification checklist, and all these things we have developed to overcome the challenges, the challenges which we faced in the structure. And with all this development of a proper SOP and planning, the process, whatever process challenges we had, we have overcome. And so that was about the neurosurgery nurse-led clinic. Other than this, what else we are doing in neuro over here? We in the ward, I told you that I go to this wards for supervision. So like we implement communication board and many other small interventions as a part of evidence-based nursing we try to implement with the help of nurses. Nowadays, because all the nurses who are trained in MSc and they are very smart, so they are willing to do it. So somehow we are able to do. And other than that, the same findings I told we got from the stroke patients. So stroke patients, what we are doing is we are trying to, we have conducted few stroke support groups. And because of COVID, we could not continue it. We could conduct only 2 stroke support groups so far. And the third, we were planning by the time COVID settled, and we were trying to have an online support group, which wasn't that successful because the patients had a lot of problem in, like as a group to communicate in a group. Individual consultations were possible, but in a group to behave in a platform, patients were not comfortable, and it was not that successful. We are waiting for this COVID to settle in, now settle down, so that we can continue with our stroke support group. And also in our institute there is TBI support group, and also recently we have after initiating this clinic, we have also started with amputation clinic. For that also we are, because of this experience, I'm a part of that also. We have started, and we will be appointing, this year we had orthopedic nursing, she will be appointed as a amputation nurse counselor. So that's what our plan, hope things will work. So we are trying to provide the nurses who are specialized in various specialty, the specialized role, which can really matter a lot for the patients. And during COVID also, because when COVID came, though COVID was not my area, but then that no one was expert in COVID and no one has ever faced a pandemic. So I thought, okay, let us take some challenge. And as a team, different teams, we have worked, and we have, we could find some kind of contribution during COVID and implement it also. This is one of the enhancing the safety of frontline workers through remote audiovisual aided doffing approach our institute had developed. We were the one who was implementing in this. So we have, like it was like where the people who are doffing are continuously monitored and given step-by-step instruction to doff, which really aid in a very less prevalence of infection, prevalence of COVID in nurses and other healthcare workers who worked in COVID. And other than that, this is with the team of Bhubaneswar. So they have taken an initiative to analyze and compare Korea and United States. So these are some of the small contributions which we could do through my research and with a good team everywhere. Whenever you want to do something, if you have the right vision, God will give you the right people. So I have worked with different team. I really thank each and everyone who is a part of my team, who work with me, with whom I work. And always we learn from each other. And when we talk about nursing specialization, many of us are getting specialized, especially AIIMS Delhi only have started in med-surg for the neuro cardio like that. So I had the privilege to be first and in the first batch to do neuro. And so here, when we talk about the patient outcome, so which all area we can bring changes in practice. So you very well know that nursing service practice, lot of changes can be brought. If you are a specialized nurse, research you can bring, you are seeing that evidence-based nursing practice, we give multiple examples. And education, yes, we can bring lot of changes, and family and community. Though it's not there in syllabus, every time I send my neuro students to community so that let them identify the primary and tertiary preventive needs and the interventions what they can do in the community. So being a neuro nurse or a specialized nurse, they should know what implication what we have for the community. So I do that actually. And now I feel that we are waiting to see. Now most of the wards in every institutes are manned by maybe diploma nurses or BSc nursing, but they are fantastic. They do a lot of job, but I really believe that as the time goes, the young nurses who are doing specialization will come to this particular position of administration, and the changes are even going to be really different and drastic. So we know that specialization, the nursing specialization contribute to improvement in healthcare outcome. It improves the patient outcome, patient satisfaction, hospital stay, cost, hospital readmission, it is being reduced, medication adherence, and it improves the quality of life, various aspects. And it also not only benefits, see, this is one of the thing like we could do. I was talking about the dietary intervention for the pituitary, which I already has shown how patients are getting benefited. Here really we could really drastically see the difference. Small intervention. Not to drink juice during post-operative period, but drink water when you feel thirsty. This was our intervention with some more additional things, but this was our main intervention. Drink water instead of juice during the post-operative period after pituitary surgery. This was our main focus based on a physiological aspect of hypothalamus functioning. So this study is very, very close to my heart, because here we are really not just here and there, we really tackle the physiology of the brain. So this is, and I'm so happy that this is as well published in a good journal. And how nursing specialization is a benefit for nurses. So it helps in redefining the role of nurses. It helps in advanced roles and extended roles, expanding territory of practice, autonomy, job satisfaction. It reduces stress, personal satisfaction, and image of nursing. So I can say that when we do specialization, when we continue with all this job, I'm experiencing most of these things. But when it comes to many people, like many of the pass out specialized nurses ask me, we need extra salary to implement whatever we learned. But I don't know whether we really need. I'm doing all these things. I'm not getting any extra salary. I'm just getting the salary of a lecturer in PGA. So we are not getting any extra salary. That should, I want that time to come up, especially specialized nurses, like we have stroke nurses, neurosurgery nurse counselors. So that time should come. And I think our leaders are working for it. Definitely it will come. Definitely it will come. But I can say that we can experience all these things when you have good competency, autonomy. You can really feel wherever you involved, OT, any conference, you can stand unique. You can stand, independent when you have a good competency in your own specialization. I'm not telling you specialize in all these things. You specialize, be focused in your own specialty. So that will give you a lot of autonomy, job satisfaction. You'll be able to focus and work. You have seen how our focus was, and how every MSc students, when they came, we also take some other project, initiate other project during COVID. Also, we took stroke support group like that. Individually also we take. Other than that, even when the students, any project when they are doing, I have a purpose for it. How we can implement into the clinical practice, and majority I try to implement, or I continue with the finding I got this year. I try to continue next year. So like BSc, so I told you that because of all this, my small works, the person who I used to say BSc honors nursing, that's following nursing, Now I can say that, not a proud nurse, because I don't think that I'm a proud nurse. I'm still humble, learning from everyone, every day, every moment, even from my students a lot. I can say today that I'm proud to be a nurse. So really, I can say I am really thankful to everyone, especially if I talk about my research, full support, the full vision I developed from Dr. Manju Alsa ma'am, Dr. Sandhya Gupta ma'am, and my husband, Dr. Dandapani. And or many others have worked with me in different ways, in different aspects, my students, and many of my research we have done through our students. I thank all of them, and I thank all the teachers of BSc. I think all teachers, like I can name them, like Dr. Pillai ma'am, Rachel ma'am, Kiran ma'am, Geeta ma'am, Mala ma'am, Soki ma'am, all the teachers, different things we have learned, Gayatri ma'am. So like different techniques we learned from each and every teacher. So during our BSc, it was though less teachers where they gave us a lot of experience. Even during MSc, they helped us in developing good vision. And I thank my family members, students, and more. And above all, I thank the patients from whom we all learn everything in our related to our profession. No doubt about it. And also, I thank all the institute administrators for helping me to do all these things. And again, I really thank Society of Indian Neuroscience Nurses. Again, recently we had started a short course in stroke. So that also through society only we could do it, because by identifying the need of stroke nurses or strength empowering the nurses in rural setting about stroke and identification of stroke. So it is not only the professional context that we need to empower to empower our profession. We also need to, in our each and every behavior, how you are outside the profession also matters. How a nurse should be, how people will start respecting nurses. And so with this, I always, this is another paper we have written, like envisioning nursing profession grounded on advanced nursing education. So Florence Nightingale envisioned 200 years back, and today we are here, and it is our duty to envision the future nursing so that we can train with that. By looking at that, we can train our nurses. So we need to redefine nursing. It is very, very important. So we know that specialized nurses and nurse practitioners have a lot of role in enhancing contribution of nurses towards improving the healthcare outcome of the country by raising the standard of nursing education and quality of nursing care practices at par with global standards. We are nowhere less, because we know that globally the nurses who are well recognized, many of them are Indian nurses. Even my batchmate, Dr. Manju Pallam, you know that I think she also should be one day speaker over here, I believe. And so they all are doing good job, and they are well known globally. So, but in India also we need to bring that change, and our nursing service should always be par with the global standards, and as well as education. Our education is very good, but only there is a gap between education and practice. And nurse-led clinics, definitely it's a way to redefine the role of nurses and improve the autonomy of the nurses and satisfaction of the nurses, and improve the outcome of the patients. So nursing education and research really play a major role in redefining this role, and making our future young nurses to empower them through our arts, education, and research. So we know that the song, little drops of water, little grains of sand, make the mighty ocean and the pleasant land. So we know that we all are this drop. We all have to see, when we little drops of water make a mighty ocean. When we look at this, we feel that we all are, each of our contribution matters for the formation of this ocean. Similar to that, each and every tiny contribution each and every one of us make is important for the growth of our profession. Very, very important for the growth of our profession. We should not be thinking that, okay, there is no need, okay, what is the use of doing? So, but if the profession, our profession has to grow. I was telling that if I believe that one day I will feel that I'm in a profession where we all are proud to say about. So I can say that if we are not contributing to this, so you know that when you think of an ocean continues to evaporate. And if the streams are not reaching, every drop is not reaching the ocean, one day the ocean will dry up. Ocean will dry up. Similarly, if we are not contributing our contribution to the profession, it is already happening. We know that. You know that an ocean, water goes, take an example of a river, the water is coming down, weeds settle in, isn't it? Weeds or other things. So similarly, in our profession also, when we stop contribution from our side, other professional centers, our tasks are being taken by other professional. Already it is going on. Physiotherapy, respiratory therapy, OT, technique, so many other courses are coming in, and our profession will lose its dignity if we don't take step now and if we don't contribute. So I encourage each one of you to contribute the way you can while balancing your personal life, family life, and professional life. You have certain professional responsibility, but doing your best, consider it as you are a part of your professional journey or professional work. And once again, I encourage all of you, and start where you are and use what you have and do what you can. So this is what we have done, and I was explaining throughout. And plan well with a goal, and it doesn't matter how you start, but how we finish is more important. So if I talk again about the journey from research to practice, so our journey is on. So hope we'll be able to finish it complete successfully. So today, take a decision that we initiate. So you may not be able to change everyone. So you initiate, so others may get inspired by you. That will become an influence to others to contribute more to the profession, which will benefit you as well, benefit us as well as benefit our patients. So thank you all once again. Thank you for patient listening, and once again, thank you.
Thank you, Dr. Thank you, Dr. Manju Dandapani Madam, for
Thank you, ma'am.
taking us through the journey of your experience of research and how you transformed into practice and still practicing. And I hope and I'm sure this must be an eye-opener for many of the nurses who is in trying to or would like to explore the or expel in the field. And I opened the floor for discussion for some time. So the participants, I think we have 100 participants. Always the meeting was full throughout with 100 participants. That is a limit we have because we use the free account. We hope to you subscribe in future to admit more. And we have you streamed in YouTube also. So if anyone have query, you can feel free to ask. There are feedbacks in the comment box, but if anyone would like to talk or if you have any specific queries, you are welcome.
Good evening, ma'am, Manju ma'am. Yeah, I am actually alumni, 96 batch of BSc Honors Nursing, and actually this is a great initiative by Lata ma'am. Great thanks for her because alumni is getting a shelter. I am really very happy. Ma'am, your presentation was really very awesome and very practical way of identifying the problem and also solving. The venue also is so different. It really gives a very new scope on the things and how you carried out the presentation. So it's full of energetic. It's really very awesome, ma'am. Hats off for you. And seeing you itself is a great energetic, I feel. Ma'am, I hope you're muted.
Yeah, I really want to thank my seniors from we have learned a lot. Actually, madam, you know that like our fourth years they had their management posting in that they used to, supervise students in what, right? First year students. That I hope it is continuing now also because from there we have learned a lot. Actually, in first year, usually in other colleges, many colleges where I work, they say that first year, no, don't touch the file of the patient and all. You just, look at the basic care and provide. But there, our fourth years taught us everything. And we are fresh with the science after 12th, and we could understand everything. It's not that we could not understand, we really understood each and every piece, and that only actually gave me some likeness and some motivation. And I remember in second year onwards, all the medical and surgical class, I used to be in the first row and the first bench and sitting and listening to the classes. So it was really, I actually that base which they have created. Because while many other colleges, they say, don't touch the patient and don't touch the file, don't read. Every piece of word from the file they taught us. As well as when we supervised our juniors, we had really prepared to train them. And as well as we got a lot of autonomy and a kind of independence and a lot of hold in the subject. So that I really appreciate that particular kind of management posting which fourth years had. And I think still it is going on and still it should be utilized. Thank you so much. I'm really awful to my seniors.
Seniors were really like a teacher.
Really.
Thank you, ma'am. Thank you, ma'am.
Thank you.
Any more questions? Anyone would like to share?
Anyone like to
Your
share? Many
experiences?
seniors are there.
Yeah. I think you have highlighted the importance of seniors in, grooming us. That I can see, particularly in undergraduation in AIIMS. Is there anyone to share anything?
Akkamma, Dr. Akkamma, are you there? She's my batchmate in MSc.
Yeah.
Yes, thank you, Dr. Manju. Nice to meet you on this platform once again. Nice to listen to you again after a long time. It was really awesome. A lot of experience and a lot of information in the session. Congratulations.
Thank you so much, Akkamma. You are the brightest student in our class and always punctual and studious. So nice to meet you.
Thank you for your kind words.
Yeah, and I know that 2 years, if someone has learned, because you did not have any clinical experience before, but you really had compensated. Morning till evening, you used to be in the ward and learn full, clinical aspect of pediatric nursing. Because otherwise, it's not possible for someone to in 2 years because I had previous experience, so neuro was not a big deal for me. But for you, it was a challenge, but you did it in 2 years. You completely took pediatric nursing in your hands. I know that. So it was
Actually,
like a great motivation.
Our program was structured very well,
Yes.
so that even a fresher would be able to actually gain those clinical skills and competencies. And I still
Exactly.
remember the way we were assessed, even during our masters. I have been working in different universities across different parts of the world, and I'm still able to compare. I would say ours was one of the best training. And even from the assessment aspects, I have been working with nurses and academics from different parts of the world, and I can really see the difference which we have based on the learning we had at AIIMS. So anyway, it was really wonderful.
And really hats off to our teachers who planned. Being the first batch, we never felt any drop of any point of deficiency anywhere. So even many of the established institutes, because I told you about my journey in different institutes, we always find a lot of deficiency. But in being the first batch, there was no delay, no problem, nothing. Only that floppy problem used to be there. When we used to come with floppy, it would not open in the computer. Otherwise, nothing went wrong. Everything used to went perfectly. All teachers of AIIMS College of Nursing deserve, a big applause for that. Like this much structured, no one can plan. That only helped me to, when you plan something, it has to be planned well. So that was really a motivation. It's not learning MSc. How someone could plan such a big program in a so structured and coordinated way. The day first, we had all the list of seminars, presentation, dates for journal club. Being the first batch, it was amazing, Adama, right?
Yes. Also, I would also say that we were prepared to transition easily across changes required and adapt to changes and reach the level we need to reach.
Exactly.
The training was so good, I would say. A lot of things to learn for us to implement even when we are training students. Recently, like I'm currently working with Children's University Australia, one of my students came to me and told there's a lot of difference between the training we provide and the training provided by other academics who are trained elsewhere. So there's a lot of difference, the knowledge, the expertise, and the way we are able to transfer the concepts in nursing. Uh, I would also agree with Dr. Manju that it's only because of the training we received and our background is so strong, we are able to do that.
Thank you, Akama.
Thank you.
Thank you, Dr. Akama. It's nice to hear from you. I hope you also will join in future. Join us in future for alumni speaks. And it is my request also to all the alumni. We are reaching out to the alumni to speak, and also you can propose if you have any important area to talk or share your experience. You can propose us with the topic. We can arrange. We can fix the date. Is there anything else?
You can see the speak over here.
Yeah, hello, good morning, Dr. Manju, I'm good. we are trying to implement certain things because we have those practitioner course. Platform for all of us, and it is a great day in the history of alumni speaks. I would really cherish the day. Thank you very much.
We can see Sumi Sakriyas. I think he left, I think.
Conclusion of today's alumni speaks. I thank Dr. Manju Dandapani for taking out time and share her experience with us, and it may be encouraging for many of the young nurses and as well as those who are in. Yeah.
After they complete their course, they don't understand what they have to do.
Yeah.
They feel lost. We have learned so much, we are not able to implement.
Yeah.
So these are the different areas you need to identify.
Yeah.
Go step by step, but you have to bring that change. Otherwise, our profession will never improve. So you are the one to motivate and you are the one to influence others. Now, many of our pass out students, my students, yesterday I had a talk who is working in AIIMS Patna now. She is neurosurgery trained from with us. And she was telling, ma'am, so I'm the only neuroscience nursing and nurse who is here in Patna, in AIIMS Patna. So we have a team. So I'm every day conducting coach training, and we are also planning for doing some research. I'll contact you for the topic, this, that. So this is how you motivate them and send. That is your job. And many teachers would be here. So you just motivate them and do. You cannot do everything. You need people. Just equip them, they will do it. One day we want our profession to be grown, not our personal growth or personal achievements. So our profession should be shining one day. So each one of us contribute, we will see the success.
Once again, thank you very much, madam, for joining us, and I thank all the participants, and once again, I extend my thanks to Dr. Lata Venkatesan, Principal College of Nursing, to initiate this Alumni Speak series, and I hope we will meet many more seniors and achievers and those who are excelling in their profession in near future. So keep joining us, and we'll be keep meeting every week to share our experiences. Thank you very much. Yeah. Yeah, as I was talking, I think Mike was muted. I thank Dr. Manju Dhanabani once again for joining us, and all the participants who joined with us. And I extend my thanks to Dr. Lata Venkatesan, Madam, Principal College of Nursing, for initiating this wonderful Alumni Speak series, so that we are meeting many people we never knew before, many seniors and many other pass outs, either undergraduates or postgraduates, those who are excelling in their own field in their own way, and it is a platform to share and pass the positive vibrations to others, so the others also get encouraged. And I request all of the participants to join us again every week, so that we will share our experiences. And as I told you before, that we expect more proposals from alumni to talk on this platform. We also reach out to the alumni, as we know, or the alumni as they share that, or as they express their interest in speaking in the alumni meets. Okay. Once again, thank you very much for joining us. Thank you.
Thank you, Lata. Thank you, Dr. Muthu, and all the participants.